Well, ladies and gentlemen, thank you. It's a real privilege to be here this evening, fresh from the plane in Toronto this afternoon. Sick Kids is indeed one of the world's preeminent child health organizations. We were founded in 1875. We are the second oldest children's hospital in the world after Great Ormond Street. We treat 230,000 patients a year from across Canada and around the world. We train over 1,100 fellows and residents who come from 70 countries around the world. Indeed, in Canada, 8 out of every 10 pediatric specialists were trained at the Hospital for Sick Children. From a research point of view, we are world leaders in research. Everything from, if you were a child, an apeplum, it was discovered at Sick Kids. The gene for cystic fibrosis was discovered at Sick Kids. We are now working on unlocking the genetic code of autism because we are a world center in that respect as well. It truly is a fantastic place. HKI is the international arm for the Hospital for Sick Children. Our vision is that every child deserves to be healthy. We do this through our Global Child Health Program. Our mission is to build capacity to deliver pediatric health care in countries around the world, particularly developing countries. Let me give you a few examples. First is a nursing education program that we are now working on in Ghana, Ethiopia, and Tanzania. Countries that have nurses, but not pediatric specialist nurses. We're working on a global sickle cell disease network. Do you know the second leading cause of death in Africa for children after AIDS is sickle cell disease? Sick Kids is leading the world in bringing together researchers and practitioners to help find new cures to treat sickle cell. We have a program in India where we are developing a network for ophthalmology, children who have no access to resources in their home country to be treated for vision problems. And in the Caribbean, we're building the very first program to be able to treat children in the Caribbean who have cancer. They either have to go to the United States or cancer. We're building that capacity in the Caribbean as well. We have a second part of our mission, and that is to also treat children in need. We do that by bringing over 600 children to Sick Kids almost every year from 100 countries around the world, where our surgeons and our nurses will perform life-saving surgery for free. We also take our kids and we deal with kids out on the road in developing countries when our surgeons and nurses go out through our No Boundaries program to help countries that just don't have the capacity to treat their kids. And I'd like you to see this video that really describes the No Boundaries program. Let's do it here.
Morning than in 4 weeks at home.
A strong muscle next to the weak muscle will operate on those.
And just the obstacles they have to overcome just to seek medical attention is, unlike anything we ever experienced in our culture.
I think that one of the biggest challenges to pediatric healthcare in Ethiopia is the fact that there's only 4 pediatric general surgeons in all of the country.
Pediatric surgeon works with me and also my residents work together and learn new techniques. So this is the knowledge transfer is the most important thing we acquire.
One of the important things that we do as surgeons is we teach the next generation of surgeons.
Working with Dr. Angela, I can have a good experience.
So in simple terms, we're building a partnership, a friendship, but we're assisting our Ethiopian colleagues to build capacity and sustainability within their systems.
I really think that the key to surgical training is getting these guys to Canada, because then they can capture the skills and take them home.
I'm very excited to go back to my country, help and start seeing patients. There's going to be an excellent opportunity for me to help my community.
Their journey begins with a single step, and I think that this is the first step.
A lot of the children that we saw today that we can't operate on now, you may be able to operate on in 6 months' time.
You guys are saving life of kids. Your support is coming to us and making changing life of many children. We love you so much.
Every child deserves to be healthy. Your support will make it possible to support these kinds of missions to developing countries around the world. Thank you very much.